Welcome to our podcast, Journey into the Future of Medicine. I'm your host, Bill Maggio, Chief Executive Officer of the Jacobs Institute. We are a nonprofit medical device innovation center here in Buffalo, New York. Here we talk about what is possible in the next quarter century of medicine and healthcare, based on a report we published titled The Future of Medicine.
Due to COVID-19, this episode was recorded through an online platform, which accounts for differences in sound quality. Dr. Leonard Kaplan is a physical medicine and rehabilitation, regenerative medicine, and anti-aging medicine specialist. After working for 11 years as an interventional spine and sports specialist, he established Osteopathic Wellness Medicine and Wellness Center, or as it's better known here in Buffalo, OWM Buffalo, in 2014. He believed he had more to offer than traditional treatments do. Dr. Kaplan uses holistic and natural methods, as well as cutting-edge stem cell treatments for regeneration and IV treatments for inflammation and immunity. Dr. Kaplan is part of the prestigious BioRest Network, which is headed by Dr. Matthew Cook. It is a network of anti-aging and regenerative medicine doctors. He is board certified and completed his residency at the University of Washington in Seattle. Dr. Kaplan, it's a pleasure to have you with us today.
Bill, it's a pleasure to be here. Thanks so much for inviting me to this. This is great.
No, we're so excited about the conversation we're about to have. You know, as a not-for-profit, the JI hosts this podcast to serve as a catalyst for conversations around medical innovation, which complements our mission to accelerate the development of technologies to treat vascular disease. Your innovative treatment methods make you a really wonderful guest for our show today. So let's get started with the questions. You're doing incredible work on anti-aging and regenerative medicine. You've brought treatments to Buffalo that are cutting edge. It almost sounds like science fiction to me, I have to be honest with you. I think this field of medicine that people know very little about. We know the basics: eat right, work out, don't smoke, get plenty of rest, drink a lot of water, so on and so forth. But your approach introduces new methods and treatments that could actually prolong our longevity with regeneration, almost like the proverbial fountain of youth. Everybody wants that for sure. So tell our listeners at that 30,000-foot level, what is anti-aging and regeneration medicine?
Bill, great question. I think you're right. I mean, I think we're getting smarter as a society, so we are starting to do better and smarter things for the body. And it kind of starts with that, right? It starts with just taking care of yourself. It starts with the basics like eating right, eating clean, But anti-aging science dives deeper, So at the 30,000-foot view, as you're saying, you're looking really at the body's ability to maintain right levels of energy, the body's ability to maintain right levels of repair. As we start to age, those processes slow down. So it's really about keeping us at that 30 age spot, right? So I always tell people that when you're 30 years old, you're like at a sweet spot. Your hormones are slightly down. You don't have like spring fever like when you're in your 20s, where like if you're a guy, your testosterone is through the roof, So you have a little bit of, you have a little bit of sense, but you're super athletic at that time if you're, especially if you're doing sports, and you recover just, in an instant. I tell people, like, when I see folks in their 30s, I mean, I just breathe on them and they get better, So what about getting that, right? Getting that ability to recover and repair when you're 50, when you're 60, when you're 70. And that's that's really what it's about. It's optimizing your health to that point where you stay in that spectrum of like a 30-year-old.
It's funny. I just read something about that. Real endurance athletes, marathon runners, rowers, cyclists, they really don't hit their peak until their late 20s, early 30s. It's really, I've never heard a doctor say that to me about that sweet spot. That's really fascinating.
Yeah.
Just tell me so we could just kind of set the stage here. So what's a typical day like for you? I mean, what kind of patients do you see? Are they more athletic? Are people... just tell us, I mean, are people aware? Are you gaining awareness? Mm-hmm. I mean, what's a typical day in the life for you?
Yeah, I mean, my days are amazing. I'm extremely lucky to do what I do. I look forward to coming into the office. Every day is an adventure, and it starts with just amazing patients and clients coming in through my door. As a wellness doctor, people that are coming to me, they're coming to me because they want to get better. So it starts with people that are taking care of themselves, and they want to get control of their health. They want to be at that optimal level. And as far as the problems that are coming in, it kind of split 50-50 at this point. There are half of the folks that have like joint problems or spine problems, right? And they want to fix those naturally without having to go through surgery. And then we offer them certain treatments that do that. Maybe we can touch upon those. And then the other half, will come in and say, Doc, I've had this immune condition for a long time. I don't want to be on toxic drugs. Is there a natural way to get better? Or I have this chronic infection I can't beat. Is there a natural way to fix that? And then there is also a smaller portion which is growing steadily. People that are doing well, but they want to do better, right? So those are the people that are owning their own businesses. They're CEOs of companies. They want to maintain that sharp edge mentally and physically. And there's anti-aging medicine treatments that can do that. So it's an amazing broad spectrum, right, that we cover here.
So, I mean, this is an assumption I'm making here. So you get 30-year-olds, 40-year-olds, 50-year-olds, 60-year-olds coming into your office, I would imagine.
Yeah, so it starts in the teens.
Wow.
So my population, because of the athletics, usually. Some, yeah. I see a couple of chronically ill kids too, but typically it's athletics, and then it goes all the way to the 80s. Some 90s too. Yeah.
Yeah, and you mentioned the treatments. We're certainly going to get into that in a moment. So let me shift gears here just a little bit. Our Future of Medicine report, which I know you've looked at, covers a range of extremely interesting topics. Along with regeneration, the report predicted the current pandemic, not necessarily a COVID pandemic, and a chapter titled Pandemic Arms Race. So I'm going to move in a little bit of a different direction, but just real quick, what's your take on the COVID pandemic right now?
Well, I mean, we'll focus on kind of like what I could do for somebody, or for people in the COVID pandemic, because obviously it's a super charged.
I'm talking at a high level, just in terms of how we've handled it in general. I mean, here stateside. I mean, don't want to put you on the spot, but just kind of curious on your perspective.
Well, I mean, I think that like a lot of people think it's been disorganized. I think that a lot of the decisions have been made that have been more reactionary than based on science. Right. I think that the science is starting to bear out some of the facts that really kind of disprove some of the things we've gone after. And it shows that very, very clearly, and it really never really diverted from that, is that we really have two populations, and it would have been smarter to treat it as such. We have a population that has chronic illness and are very old that are super susceptible to this. And then there's like the rest of the folks, and if you sequester those folks and really protect them, it really could have been held differently where the whole country, I don't think, had to shut down. Now, that may be a controversial comment, but that's just my opinion. I think it was a little bit of an overreaction.
No, and I can assure you our listeners are very interested in your opinion about that. And no, it's just an opinion. But it leads me to this question. One of the things I heard over and over again was, some people just don't take it seriously because it primarily affects old people. Right. And I think that I can certainly say, given my role here in the community, that's certainly true here in Western New York. And I think for the most part across our great nation. But that doesn't have to be acceptable in my opinion. So I guess the question I have to ask for you is that if people started earlier on in life, are there things that they can do getting into the treatments now that would have made older people more, I think, resistant to this? So maybe this is a nice opportunity for us to pivot into some of the things that someone in their 30s and 40s and 50s can do that will ensure when they're in their 70s and 80s, they won't something like this in the future won't be a death sentence to them.
Yeah, that's an amazing question. I mean, I think that's really the kind of the nut, right? Because if your immune system is resilient, it doesn't matter how old you are, right? So, and the resilience of the immune system is not a one-day exercise. It's not a program that you do for 6 weeks. It's a lifetime change, right? It's a lifestyle change. It's a way of life, right? So that training starts early. It should be starting in schools. We don't do enough of that education. And then the physicians, the primary care doctors that are supposed to be kind of like the gatekeepers, in my opinion, are failing at educating people in doing things to promote that immune resilience, right? Because, I mean, a lot of it can be done with, as you said in the beginning, look, I mean, it starts with the right kind of eating habits, right? It starts with the right kind of exercise. It's just not enough. It's not of that. But of course, if you take a step further, again, then you can become more proactive, and then you could do actual treatments that physically, there's this term that's been thrown around that's become popular called biohacking, right? And the biohacking basically means that you're kind of hacking into your own system and tweaking it to work faster. Think about tweaking a computer motherboard to process information at a higher rate or something like that. So that can be done as well, but then folks have to seek out specialists that do that, right? General practitioners are not going to be able to help them with that. That's where someone like myself comes in. And it could be done proactively and protectively as well.
Yeah. So Buffalo, I think is more like most communities as opposed to like New York or LA, who, I suspect that some of the things that you're doing are a little bit more well known and it's bigger, more
100%.
hip cities, right? So from what I understand, and again, I'm not a doctor, but I understand that this particular virus, the COVID virus, is devastating to the lungs.
Yes.
So let's talk about some of the treatments that you think going forward. If we could get primary care physicians to think more about the holistic things that you're doing, and I think that will come over time, right? But if we could get them to do that and get them to start looking at these things at a much younger age, what would be some of the things that people could do? I mean, what are some of the current, advances that you apply to your patients that could make them less susceptible to something like COVID?
Yeah, so they've shown that our lungs and our upper respiratory tract in a healthy, robust immune system produces something called nitric oxide, which actually is toxic to the viruses. So it's our natural antiviral treatment. And that ability to produce nitric oxide declines as we become older and we actually become more inflamed, right? It's been shown that exercise boosts your ability to produce nitric oxide. So that's just a quick one, just to kind of go back to the basics. From the standpoint of things that I've been doing that starts to promote that a little bit more, one of the big ones is something called ozone. And when now again, remember that there's lung tissue, and on the other side of lung tissue you have capillaries and blood flow, right? And what happens with the virus is that it inflames the lung tissue, but then it crosses over to the circulation side and inflames the capillaries. And this is why people have been reported to have strokes, and clots, right?
Yeah, the clotting issues, The
clotting issue, right? So it's working on both ends of the system. Right. And when you do, let's say, this introduction of ozone through an IV, it's called a superoxygen. It creates this nitric oxide production through the entire vascular system and then blocks inflammation of the vascular system. It actually could be potently antiviral as well, hypothetically killing COVID. Of course, we don't have proof of that, but it's been shown to be antiviral against viruses like Ebola and even herpes virus and HIV, right? So there have been some prior examples and experiences. And then I've actually combined it with something called ozone inhalation therapy, where you could take a little nasal cannula and then you breathe in something that, where the ozone is passed through an extra virgin olive oil. And what happens there, which is fascinating, you have terpenes, which are natural antioxidants that make the olive oil green and actually make all our plants green, right? The ozone becomes hydrogen peroxide. It binds to the terpenes, and both are aerosolized, and you're breathing them in. So you're coating your lung tissue with these antioxidant terpenes in these ozonides, which are anti-inflammatory and antiviral. So throughout this entire pandemic, all of my staff has been treating with those inhalation treatments, including myself. And we've had people coming in for that. Now, again, can I tell you exactly 100% that it's going to kill coronavirus? No, but you certainly are stacking the chips in your favor when you're doing that. So ozone is amazing for that. There are peptides. These are small amino acid chains that have been also shown to improve immunity and help your body recognize viruses faster and kill them. So they're actual peptides that you can do as a self-injection. These are very, very cutting-edge treatments. So peptides and ozone have been kind of on the forefront of this in a lot of clinics in the country,
I'm not suggesting that this could kill COVID, but if someone were to work these treatments into their healthcare regimen at a younger age, I think one could safely say that it's not going to hurt them. It could certainly help them be more robust in fighting a virus like this in the future.
Oh my goodness. So we talk about this optimization. So there's kind of he's called the grandfather or the godfather of ozone therapy, and that's Dr. Frank Schellenberger, who works out of Carson City, Nevada. He brought ozone from Germany to this country 30 years ago. So he's got 30 years of experience, and he's done some testing on your body's ability to extract oxygen and also produce nitric oxide. And he's shown that those levels drop off as we age, which is part of the aging process I was talking about. But he has people in his 80s that he's tested that have gotten routine ozone administrations where literally, just like you and I talked about, their oxygen utilization is at a level of like a 35-year-old. And so these people are coming in every 3 months and they're getting like an ozone treatment, for instance. So he's kind of already demonstrated that in his clinic. We're basically just starting that up in Buffalo.
So just on some of these more, and I just have to ask this question, but on some of these more unique, you talked about these unique therapies. What's the reimbursement culture for that? I mean, is this something that's being recognized right now, or is it something that people?
So it's interesting. So when I left my former clinic, which was just a sports medicine clinic, we dealt with insurances. At some point, I knew the medical directors by first name. And, when I left and I told them I was doing this, they some of these insurance companies told me before I even open my mouth, don't even try to get these reimbursed, right? So we're just not doing it. So this is how proactive they take the stand. So since then, this is six years later. They're starting to, I think, look at platelet-rich plasma maybe as a potential. No one's really looking at stem cells. No one is definitely looking at ozone because ozone is like a bastard child. They don't understand how it works. They don't really want to know. It's been difficult to get it to be prominent or even to be accepted as a potential treatment, let alone to be reimbursed. So we're far from that. Yeah.
But you're a pioneer, and it's really fascinating. And your passion, your knowledge about this is so important for our listeners. And I believe that at some point, this is going to become a fairly routine part of people's healthcare regimen. I do.
I think so. I do believe that. Yes.
I really, really do. I'm just curious. Stem cells used to be a fairly controversial topic back in the 1990s. But we're finding useful and ethical ways to reap the benefits of these cells. Does this play a role in what you're doing?
Absolutely. So stem cells are, they have come to the forefront of regenerative medicine probably over the last 5 years, I would say. I mean, certainly people have been doing them longer than that, but they've become more prominent. And not only just because of the stem cell itself that we can extract from the body, but now because we actually have these methods where we can culture stem cells in a lab and collect these amazing genetic byproducts of these stem cells that they excrete that then regulate your tissue's ability to repair. So those are called exosomes. And so the exosome, I think, has been probably one of the most exciting innovations over the last couple of years. So you can culture young, vibrant stem cells. Sometimes they're going to be better than your own, especially if you have a chronic illness. But you're not taking those stem cells and injecting them. You're actually taking these excretions from the stem cells that connect this genetic code that then tells your body's injured cells to repair. It turns the repair mechanism on. Those are clean, sterile products. They're potently anti-inflammatory. And what's cool about them is they're versatile. You can inject them into a joint and turn the repair on, or you can do them as an IV, and then they go systemic, and they kind of search and destroy injury or inflammation wherever it may be found. Incredible stuff, right? So exosome, I think, right now is kind of like the exciting topic, so we could do stem cells that we can extract from the body, and that's awesome if you're fairly healthy, and I do that a lot. I'll do that for joints, especially people that are trying to avoid like replacements, hip, knee, or shoulder replacements.
Sure.
But if somebody is kind of like you talk about obesity, if somebody is obese and they have other comorbidities like diabetes, their stem cells that they have in their own body are sick, So if I take their own stem cells and I treat them with them, I will not do them a favor. I'm not going to do much for them. So I'm going to reach for those exosomes and kind of employ them to help.
So let's talk a bit about youth athletics. I want to kind of move away from the COVID topic and everything because if there's anything, you have young daughters, if there's anything that I've come to learn, and it's different than when I was a kid. Youth athletics play. It's just so much more competitive. It appears to me now, and the kids. These young kids are injuring themselves more. My understanding is that if they get in to see you early enough, that there's a lot of things that you can do to help them avoid more invasive type procedures. So talk a little bit about that area of your practice. And I would imagine probably equally between male and female now, right?
Yeah, absolutely. So kind of classically you'll see, gymnastics, more girls because they do a lot more extensions, cheerleading. And then for the guys, you're kind of looking at hockey, soccer is equally split, I think. Football, certainly more guys, So there's a little bit of a sports-specific type of an injury thing that we see. You're right about the fact that there's more injury, and I think it's because we're raising one sport athletes, right? So in the 80s, 60s, 70s, it was popular to play multiple sports. Now we're just trying to create these Olympic athletes or pros that play in one sport all year long, and they get injured because they overuse, But the amazing thing is that if they tear a ligament, for instance, right, or if they injure like a piece of cartilage in their knee, surgery is no longer necessary. Especially in somebody who's like 16 or 17, if I treat that area with a little bit of their own blood, like a platelet-rich plasma, and that will immediately start to promote repair. And as I said, a lot of times in athletes, in college athletes or high school athletes, their bodies are so revved up to repair to begin with. These are typically one-time treatments, so they're very gratifying. So somebody comes in one time, and we're talking about race. We have a Holiday Valley in Hollywood here. We have race teams. These kids are constantly injuring their knees, and some of them get operated on, which is, to me, is probably not the first step, right? If it's needed, it's absolutely needed. But certainly
for a young boy or girl.
Exactly. So PRP becomes amazing for that. Absolutely amazing.
Yeah. And you are right. And there's so much pressure on these young kids now. I mean, these athletics becomes an important part as to how some of them get into these more competitive colleges. That's really amazing that you're doing this. We're running out of time here, but I guess my last question is, where do you see all this going 10 years from now? I mean, because to me, it's so logical, right? I mean, you'd much rather do PRP as opposed to operate on just the cost alone. But also, it can't be good for a 17 or 18-year-old youth athlete to be having knee surgery at such a young age. So 10 years from now, where do you think this is going to be? Is this something that's going to be fairly routine?
Yes, it's going to be routine, and I think that I'm kind of doing this pioneering work in Buffalo. I'm behind, people that have been doing this for years in California or even south of us, like in like Carolinas or Florida, even. Ultimately, I see, an injury coming in, and immediately they get like a nutritional IV to help their body to boost the repair, and then some kind of a very localized procedure. Again, all natural, all to boost your own immune system, and it's quick. It's a 1 or 2 treatments, and the body heals, and then they're back. And then of course I think we're going to be smarter about how we feed our kids, right? And because again, nutrition is key, right? If you're eating McDonald's every day, you're going to repair less than if you were eating green salads and spinach, So, I mean, that's an old and true, but somehow we still fail to really kind of communicate that to everybody. So,
well, this has been an absolutely fascinating discussion. I'm certain that our listeners are going to really enjoy this, and I can't thank you enough for giving us your time and for what you're doing for our community here in Buffalo, and I wish you the very, very best.
Bill, thanks. It's a pleasure, as always. Yeah.
Thank you. And to our listeners, until the next time, be well. Good day.
Thank you for joining us on this journey. I hope the podcast served as inspiration to keep pushing the boundaries of what's possible in medicine and healthcare if we simply change our mindsets and practices. Let's bring the future of medicine to our Western New York community. If you enjoyed this podcast, please recommend it to a friend. If you want to help bring the future of medicine to Western New York, please consider donating at jacobsinstitute.org. Thank you for listening.